I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
We're going to be talking about sleep deprivation. Are you sleep deprived? And the chances are the answer is yes for most of you, and you don't even know it. So we're going to teach you how to spot sleep deprivation, and then what to do about it is really the key. I want you to be ahead of everybody else because you're Joe-it-alls. If you don't know what a Joe-it-all is, it's a Facebook group we have. It's a little private group we have. I want you all to join it, by the way, Joe-it-alls. For the first time ever, we now have merchandise available. We have masks. We put together masks, says I'm a Joe-it-all, and those should be available very shortly, so I'd love to have you come join us and start bragging to your friends that you're a Joe-it-all. So, I'll tell you a know-it-all, but now you're a Joe-it-all, which is better than a know-it-all. So let's talk about the effects of sleep deprivation. In a nutshell, sleep deprivation is caused by a consistent lack of sleep or reduced quality of sleep. It's pretty simple. Getting less than 7 hours of sleep on a regular basis can eventually lead to health consequences, and that's going to affect your entire body. This also may be caused by an underlying sleep disorder. One of the things that I see as a chiropractor and an orthopedist, a non-surgical orthopedist, and a pain management expert and nutritionist, is that people come to us in pain. And if you're in pain, you're not getting a good night's sleep. Garrett and I were just talking about this before the show started today, and we were talking about mattresses and how important mattresses are and pillows. And so if you're not getting a good amount of sleep, especially if you're in pain, you're not going to be able to function at 100%. Now, the number one cause of back pain, by far, is pinched nerves. So if you have neck pain, back pain, shoulder pain, numbness, tingling, restless leg syndrome, your shoulder hurts, you wake up with a headache, these are all signs that you have pinched nerves. And the number one treatment for pinched nerves is chiropractic care. Chiropractic care is the most effective, least expensive treatment for pain, for back pain. So if you have pain, I can't imagine why you wouldn't start out with chiropractic. Just before I went on the air, I got an email. In fact, I was talking to somebody, and I got an email, and he said that he's been through every test known to man. He's had MRIs and CAT scans and bone scans, and they thought maybe it was something called multiple myeloma, which is cancer of the bones. It's not that. They want to do a bone biopsy. And I spoke to him. And I said, have you ever considered chiropractic care? He goes, no, I've tried everything else, injections, medications. He says, I'm dopey as can be. I've had so many nerve blocks. Nothing's helping. And I said, let's start with the basics and go from there. He says, I'm ready, doc. I've spent a ton of money. He says, I'm not getting the results. I'm ready. So he made him an appointment. So yeah, you always start with the basics. My grandfather was a German immigrant, and he taught me that too. Start with the basics. Many times that solves the problems. You could always build up from there if you need to. So chiropractic care, most effective, least expensive treatment for pain. Many times that solves the problem of sleep issues. Can't sleep, you're in pain, go to chiropractic, get chiropractic care, pain goes away, you feel better. But here's the thing with chiropractic, 90% of your nerves don't feel pain. You can have a pinched nerve and not know it. Those nerves control organs. So now we may have an organ malfunction because the brain isn't talking to the body because the pathways are being blocked or pinched. And so now the organs aren't functioning, and that can affect your sleep as well. So you don't have to just have pain, you just have a malfunction of something, and that can be causing your problems. So your body needs sleep. It needs air, it needs water, it needs sleep. During sleep, your body heals itself and restores the chemical balances in the body. So it's really important that you get this done. Your brain forges new thought connections. Your brain actually starts to heal itself when you're sleeping. If you're not getting into that deep REM sleep, not the band from Athens, but the deep rapid eye movement sleep, your body isn't working, and so your brain can't work. And your brain has to heal. When I went to school, I was taught that once a brain cell was damaged, it was damaged forever. There's nothing you can do about it. Well, it turns out that research was wrong. Your brain does grow new cells on a regular basis. Right now, your brain is producing new cells. And if there is damage to a certain area, the brain can rewire itself. The brain has a quality called plasticity. Plasticity is like plastic. It can bend and mold itself. So with plasticity in your brain and the ability to generate new nerve cells and new brain cells, your body can heal, but that has to happen when the body is rested. So if the body isn't rested, you're not able to go into that deep healing. And so that's why it's so important for our patients, we have 6 doctors, our patients to get well, because we want to get them into that deep, restful sleep. And sometimes it's due to pain, sometimes it's due to nerve malfunctions. So without enough sleep, you just can't function normally. There was a review of studies, and they found that sleeping too little at night increases the risk of early death. Wow. So we're thinking about pain and brain fog. It can actually kill you if you're not getting enough sleep. So what are some signs of sleep deprivation? How do you know you got it? Okay, stimulants such as caffeine aren't enough to override your body's profound need for sleep. Let me explain to you, some of you are old enough to get that reference. Let me explain to you, Lucy, how the body works with caffeine. You take caffeine in your body, and it gets into the body, and it stimulates the nervous system, but it blocks up something called adenosine receptor sites. Adenosine is a chemical in your brain that's released, and when it's absorbed into the brain, you get tired. It's perfect. It's the way the body's supposed to work. Caffeine looks like adenosine. So what caffeine does, it blocks up the adenosine receptor sites, so now you can't absorb adenosine. So what happens is you stay awake, but your brain is smarter than you. What your brain does is it says, wait a minute, I need sleep, Joe. So I'm going to produce more adenosine receptor sites. And so now I produce more adenosine receptor sites, and so I'm absorbing more adenosine. I get tired. So what do? You drink more coffee. And that's why it maybe took you 1 cup of coffee to get high. Then it took 3 and 4 and 5 and 6. I had a patient one time, was it 24 cups of coffee a day, I think it was. I thought, how do you do it? You're just peeing all day. How do you function at that level? He lost his family, lost his job, lost his wife, his children. Nobody was speaking. He was just a nut. And he wouldn't give up his coffee. And I worked with him for quite a while. Even chiropractic care, adjusting was like hitting a brick wall because all his muscles were so spasmed. That was the most severe case I've ever seen. But giving up coffee is really important. And in my first book that I wrote, Eating Right for the Health of It, we have a chapter called Kicking the Habit. And in that chapter, we talk about what to do to give up coffee. And it's really pretty easy. You put a cup of black coffee in front of you, organic only. Never drink anything but organic coffee if you drink it. 1 tablespoon of organic coffee every hour. That gives you just enough chemicals to kind of keep you stimulated, but for the brain to start to heal those adenosine receptor site areas that you produce too many of them. And so the body will start to heal those, make them not usable anymore, and then you won't get as tired. So it's a pretty simple thing to do. The longest it's ever taken me to get somebody off coffee who really wanted to get off coffee, 4 days. And that was it. And these are severe coffee drinkers. So 1 tablespoon an hour. And what will happen is you'll forget. You'll skip an hour, skip another hour. Oh, gosh, I'm feeling better. That's how it usually works. So you need sleep for the brain to heal. So if coffee isn't overriding your desire to sleep anymore, this can make sleep deprivation worse by making it harder to fall asleep at night. This, in turn, can lead to a cycle of nighttime insomnia followed by daytime caffeine consumption to battle the tiredness, causing lost hours of sleep, and it just becomes a mess. So behind the scenes, chronic sleep deprivation can interfere with the body's internal systems and can cause more than just initial signs and symptoms of problems. It can cause some real serious problems like damage to the nervous system. Now, folks, I'm a chiropractor. Okay, I'm also board certified in orthopedics and pain management and nutrition. So when patients come to us, we try to get everything we can fixed as quickly as possible. So your central nervous system is the main highway in your body. And my job, our job, my doctor's jobs, my chiropractors, my medical doctors, our jobs are to get you well as quickly as possible. And so the one thing we all have to look at is the central nervous system. Central nervous system is the brain and spinal cord. The peripheral nervous system are the nerves that come from your spinal cord out to the rest of your body. Central brain and spinal cord, peripheral outside there. But sleep is necessary to keep it functioning normally, and chronic insomnia can disrupt how your body sends those messages back and forth and processes information. Too much sleep deprivation could even lead to things like hallucinations. So again, the central nervous system needs that rest. So during sleep, the pathways form between nerve cells in your brain, and they help you remember new information that you've learned. Sleep deprivation leaves your brain exhausted. It can't perform that duty. It can't just keep rewiring itself because the brain has short-term memory and long-term memory. Short-term memory is, okay, what did I have for breakfast today? Well, I know what I had. I had Dr. Joe Super Greens, Dr. Joe's Essential Source. I had a banana. I had a tangerine. I think that was my whole breakfast. Yeah. Apple. I had an apple. I remember that. If you said, what did I have for breakfast 5 days ago? I don't remember, because that's short-term memory. Short-term memory, the brain says, is this important? Is this vital information? No. By tomorrow, it's not going to be important what I had for breakfast today. So the brain says, I'm going to forget that. If it's important, the brain sends that information through nerves to another part of the brain. That's where the long-term memory is stored. And so I'll remember my high school graduation. Okay, why? That's stored in my long-term memory. My brain said, that's important. Let's remember it. And so you're going to remember the short-term and long-term memory. If the nervous system isn't working and able to process and store these things, it's not going to work. You can also find it difficult to concentrate or learn new things. Brain doesn't want to learn when it's tired. The signals your body sends may also be delayed, which decreases your coordination and increases your risk of accidents. Now, we've all done this. We're tired. We're more clumsy. We're more likely to get in an accident. So you need to have the brain working for a safety mechanism, not just about memory, but it's about your life. You can slip and fall. You can not have the reflexes that you used to have when you were rested, and that can be a big issue. So sleep deprivation also negatively impacts your mental abilities and your emotional state. So we may know of somebody that's angry, they're strange, they're weird, they're crazy. It could just be that the brain isn't processing information because they're sleep deprived. They're tired. And then if you do caffeine, that makes you jittery. That doesn't necessarily give you energy. It kind of robs your body of energy. And then you need more and more caffeine. So that's where the problems come in. You may feel more impatient, mood swings. You can compromise your decision-making process, your creativity. Some people can do better with less sleep, but most people need at least 7 hours. So if sleep deprivation is long enough, you could start to have hallucinations, seeing or hearing things. Lack of sleep can trigger mania in people, bipolar disorders, anxiety, depression, ADD, ADHD. All of these things are exacerbated or aggravated by lack of sleep. You can have impulse behavior. I'm angry, I'm mad, I'm going to do something stupid. Anxiety, depression, paranoia, even suicidal thoughts. So many times we have to work on a patient and try to get to the cause of why they have sleep deprivation so that we don't get into these extreme cases, anxiety, depression, even suicidal. And in our office, we look at the nervous system, which controls everything. We look at the digestive system because that's the key. Many times when I have patients that can't sleep, it's a digestive problem. In fact, in the past 2 days, I had 5 people come to me with this exact same question. And I give them the same explanation. I really should just write these explanations down, just hand out cards. You know, here's this, because we get the same questions often. Now, here's the thing. If you have a question, you could send it to us through our website, drjoe.com, and one of us will answer your question. We're more than happy to help you with your questions. So if you have a question, you could send it to us, but we know that there are certain questions we're going to see over and over and over again. Pain, of course, is the number one issue. Digestion is number 2. Sleep is one of the big ones. What supplements to take is right up there. And so many times I just have to tell a patient, you know, we've seen this case before many times. Whether it's headaches, neck pain, back pain, car accidents, sprained ankles, whatever it is. And you really should come see us. Because in most cases we get great results and people are pretty happy with that. Because most people are seeking information. They seek knowledge. And you want to know, what can I do? What can I do to help myself? So with neck pain, back pain, shoulder pain, digestive issues, just make an appointment to come see us. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. We would love to be your doctors. We accept most insurances, car accidents, sports injuries, Medicare. We have a medical division as well. We have a medical doctor and staff, nurses on staff. So we do everything we can to try to cover all aspects of your health. And it's neat because a medical doctor and I many times will sit down, and he's brilliant and I'm brilliant, I think, and we kind of sit down together, and it's a clash of the titans sometimes. We get together and we don't argue with each other. We say, what would you do for this? What would you do for this? Sometimes you need medicine. Sometimes you need injections. Sometimes you need something called PRP. Sometimes you need chiropractic, nutrition. In our offices, we have all these brains coming together to try to come up with the best treatment for you. And we get referrals from hospitals, major clinics. You know the names. I won't say them, up in other states, Minnesota and Boston. And people come to us because a lot of doctors go, we don't know what else to do. So we'd love to be your doctors. If you want to make an appointment, drjoe.com. You can do it right online. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. The initial visit was $375. We can't do this for much longer, folks. We've reduced that to $199. That's an exam, x-rays, consultation, first adjustment, going over your x-rays on the second visit, and a complete nutrition evaluation. Nutrition evaluation alone is $150. So you're silly not to take advantage of this. Again, we can't do it forever. drjoe.com. And if you've ever been in a car accident ever, you need to come see us. The quicker you see us from a car accident, the better. When I say quicker, that day or the next day is ideal. We want to get in there and start doing the repair work so that inflammation doesn't set in and actually make the problem worse. So we're talking about sleep deprivation today and what it does to the body. How do you know you have it? And then what can you do about it? I want to talk about your immune system real quick because that's a big topic right now, of course. With the immune system, the immune system is key. And we know that when it comes to diseases, cold, flus, COVID, the healthier you are, the less likely you are to get these diseases. Now, I'm not saying you're not going to get them, but I believe the missing link in healthcare is no one's talking about preventive healthcare. Everyone's talking about treatment. What do I do if I get this disease? Well, I agree with that. If I get a disease, I want to get the best treatment in the world. Whether it's chiropractic, nutrition, medical, injections, immune therapy, I want to get the best treatment in the world. I think you do too. But if we prevent a lot of these things from happening, we don't have to worry about that. So the act of prevention can be passive and active. And I want you to get well. I want you to stay well. I want you to take care of yourself. When you sleep, your immune system produces infection-fighting substances called antibodies and cytokines. And it uses these substances to combat foreign invaders like bacteria and viruses. Now, with COVID, we have something called a cytokine storm. You have innate immunity, first level, that kicks in when you're exposed to something. Then it's acquired immunity, which kicks in as a second phase. But if the body starts attacking too much, the immune system starts to go crazy, you can have what's called a cytokine storm. And when the cytokine storm kicks in, the body starts attacking itself. And that's usually the thing that gets you when you have things like COVID. So keeping the immune system in check and as healthy and as functional as possible is really the goal. Certain cytokines will help you sleep, giving your immune system more efficiency to defend your body against illnesses. So you got to sleep in order to get the right balance in the immune system. So sleep deprivation prevents the immune system from building up its forces, like building up its troops. If you don't get enough sleep, your body may not be able to fight off the invaders, and it can also take you longer to recover. So long-term sleep deprivation also increases your risk of chronic conditions such as diabetes, obesity, heart disease, everything, folks. So sleep is really important. It can affect your respiratory system. Many people have sleep disorders. They can't sleep properly. Many times what that's caused by is the stomach is pushing up against the diaphragm. So let me explain this to you, and I'll get into the digestive aspects here. You have a sheet of muscle called the diaphragm. And if you've listened to this show before, you've heard me say this. And the stomach is supposed to sit below the diaphragm. Your stomach can push up into the diaphragm. And some of the symptoms you might have if you have this condition, acid reflux, heartburn, burping, gas, bloating. The stomach is pushing up into the diaphragm, so the stomach isn't doing its main job. And the stomach's main job is to take proteins and break them down into something called amino acids. It kind of breaks the proteins, little tiny components. The amino acid tryptophan, specifically, combines with B vitamins in your small intestine, specifically B6, and creates a chemical called 5-HTP. 5-HTP goes into the brain and creates a chemical called serotonin. Serotonin is a neurotransmitter that makes you happy, helps you focus. Serotonin becomes melatonin, which helps you sleep. So I cannot tell you how many cases of sleep disorder I've seen over the years, hundreds, probably thousands, where we fix their stomach so the stomach can break proteins into amino acids to produce serotonin, to produce melatonin, and the patient says, Dr. Joe, for the first time in my life, I'm able to sleep. So if you have heartburn, acid reflux, burping, gas, bloating, you might want to come see us because it's a physical thing. It's not a supplement I can give you. We need to take the stomach and physically pull it down away from the diaphragm. It's part of a chiropractic treatment plan. And when we do that, in most cases, people are thrilled. I have this condition. And when I start burping, if I start realizing that I'm not feeling full, I keep eating and eating, I'm not feeling full. If I feel bloated, almost always it's my stomach pushing up against my diaphragm. And when I pull the stomach away from the diaphragm, my doctors do, I can't do it myself, it's a whole new world. So many times sleep issues, sleep apnea is due to the fact that the stomach is in the wrong place. Then we check the nerve supply from the spine to the stomach. Then we get you on a good diet. And simply put, everyone, I feel, should be avoiding wheat and dairy products. My friend's sister called me the other day, Marianne from Florida, and she's just having the worst stomach issues and burping and digestive issues and can't sleep and pain, and she's been to 6 different doctors, doesn't know what to do for it. And I explained to her just what I explained to you, and she goes, "Oh my gosh, that's me, Joe. That's exactly what I have." So I couldn't see her. She's down in Florida. I said, "At least do this for me. Give up wheat and give up dairy products. See what happens. If it doesn't work, it doesn't work. So what? You gave up wheat and dairy for a couple of weeks." About a week or 2 later, she calls me. She goes, "I've had 1 attack since I gave up wheat and dairy products." She said, "That's amazing. I can't thank you enough for that simple advice. It was free. All you have to do is not do something." I didn't tell her to do anything. I told her to not do things. I did put her actually on digestive enzymes as well, and that seemed to help too. So fixing the digestive system is going to be the key to fixing the sleep issues. And here's the thing. If you don't sleep, your body reduces its production of leptin. Leptin is a neurotransmitter that's made in your stomach that goes up into your brain that tells you that you're full. So less leptin, you don't feel as full. It increases the production of ghrelin. Ghrelin is a chemical that goes into the brain and makes you hungry. So it increases the hunger chemical and decreases the full chemical. So what do? You eat more. How many of you, when you're tired, want to eat? I do. Okay, it's just the way the body is working. It's affecting how the body functions. And so you got to get that leptin ghrelin balance, and we do that. Another thing that happens, you do that by sleeping, getting the right sleep. It can affect the cardiovascular system. It can affect blood sugar, blood pressure, inflammation. It can affect your hormone levels. And treatment really is simple. Number 1, check the stomach, fix the stomach. Number 2, if you have pain, just come see us, chiropractic care. Let's get that taken care of. If you have obesity, that's something we might want to have to deal with. We have a weight loss program that we do. Again, if you're in pain, we have something called chiropractic and PRP. PRP is platelet-rich plasma. We take the cells out of your body, spin them down. It's the growth factors, concentrated growth factors, and put it right back into your body. We can inject into an arthritic knee, shoulder, hip, spine, hair growth. It can help stimulate hair growth, erectile dysfunction, urinary leakage for women, sexual dysfunction for women. PRP really is, I believe, the next step in healthcare. And I can't see it not happening because it's your own cells. You don't reject your own cells, which is kind of nice. So when it comes to regenerative medicine, anti-aging, PRP really is the thing to do. So if you want more information, you can go to our website, drjoe.com, click on the tab that says services, and has a list of all the services that we have. So if you do want to make an appointment, by the way, drjoe.com, you can do it right online. Phone numbers are everywhere if you want to call us, all over the website. We have over 1,500 hours of podcasts on the website. And the supplements we talked about, the Super Greens, the Essential Source, which is the minimum supplements everybody should be taking, along with vitamin D. Those are on the website, drjoe.com. We have a bunch of other supplements, hormone balancing supplements, digestive enzymes, omega-3 fatty acids. Great source of information, the website, drjoe.com. So you also want to, we're talking about sleep here. I'm almost done with time. Don't eat late at night because the stomach can push up against the diaphragm. Keep electronics away from your bed. Don't use electric blankets. All these things can affect your sleep. That's not a good idea. Our job, we want to naturally get you well and keep you well. Folks, again, thanks for tuning in. Tell your friends about the show. I'm Dr. Joe Esposito, drjoe.com. We'll catch you soon. Thanks for listening to For the Health Bit. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.